All right, we are back to talk about the things that are going on in other parts of the world now. It is dangerous to be female in a man's world. And you can see by the map that Southeast Asia, the Middle East, and much of Africa, as well as parts of South and Central America, are very dangerous places to be women. Here, let me get rid of that. The darker the color, the more dangerous it is to be female. Okay? Just so you know. And in some places, we see there's no data at all. So that's also very interesting. What you can't measure, you can't manage. Um, so let's start talking about human trafficking. Between the years 2008 and 2019, the figures on human trafficking quadrupled from 30,000 to 120,000. The vast majority of these victims are women, with many of them recruited for the sex trade. Um, there are women who are recruited as domestic workers and girls, and there are some men who are trafficked as well. Um, Usually they're trafficked for manual labor and construction, um, but it's forced labor and they don't get paid for it. And they're uh, maintained in very poor conditions and usually victims of violence as well. Um, so, what the survivors of human trafficking would like healthcare providers to know, including nurses, is that they want you to identify those red flags. They want you to see what they're going through, and they want you to make it safe for you to tell them. And that can sometimes mean that you have to ask to speak to the person alone. And that can be tough if their handler is with them, but it's necessary. Victims of human trafficking encounter the healthcare system, usually through the emergency system, more frequently than other populations. They also encounter law enforcement. So you might see posters with numbers for victims of human trafficking to call. The majority of these will be women. Our call centers report that. The biggest places involved in human trafficking are India and North Korea. But it happens all over the world. It happens in this country too. Um, Eastern Europe has a fair percentage as well, but Southeast Asia has a definite problem. What they would also like you to know, the survivors of this horrible experience, is that they want to be included in decision making about policies intended to reduce harm from human trafficking. They have a unique perspective, firsthand perspective. They know how these perpetrators operate, and they know what this experience is. And so they would like to be included in decision making, particularly in asylum granting and in prosecution. And, I think it's important anytime you're trying to help somebody that you understand the perspective of the person you're trying to help. So now we're going to talk about the Israel Hamas conflict on both sides. So this story kind of broke my heart as a labor and delivery nurse. There are 50,000 pregnant women in Gaza. This article just came out last week. And they're struggling, not just with a healthcare structure that is overwhelmed, has no resources of its own. They're rationing electricity so that instead of elevators, they're using it for NICU beds. There's food insecurity. Houses are being bombed. Generals just risk of being harmed in this violent conflict, and their water isn't safe. Think about what it's like. Any of you who have been pregnant or you've known people who have been pregnant, not having access to sanitary facilities to wash your hands or use the bathroom. Think about living in a tent while you're pregnant. Think about knowing that your hospital could be bombed. Um, it's pretty sobering. Some women are giving birth in cars, on the street, and in overcrowded shelters. Pregnancy and childbirth occur in a socio-political context. I love this quote because it's true all over the world. Women don't just give birth as a physical event. They give birth in a particular time, place, culture, with varying access to healthcare. So Repeated military assaults, the collapse of the healthcare system and the food supply, the absence of adequate shelter and general safety have lasting impacts on mothers and babies well after the fighting is quelled. And that is true for physical effects as well as post traumatic stress disorder and other emotional or mental health problems. It kind of breaks my heart. And now this is about gender based violence as a result of violent conflict. Um, Israel is not the only country that has seen this. Sudan, Somalia, DRC, all of these places have experienced rape as a weapon of war. But this particular story, I know there's a link up there, but I'm going to tell you, read it at your own peril. It is very graphically describes the types of sexual assaults that were performed on women and the things that people saw that they can't unsee. So for 2 months, Israeli officials have shared what they say proves Hamas fighters committed rape and other sexual assaults during the militant group's attack on October 7th that left 1,200 Israelis dead, including more than 300 women. The healthcare workers, the first responders that went to try and help these women, describe things that they are traumatized by just by witnessing them. It was not an act of unplanned aggression. This was premeditated. These people were scripted to do this. And so Benjamin Netanyahu got very angry at the slow response of the UN and other organizations. And he says, I say to the women's rights organizations, the human rights organizations, you've heard of the rape of Israeli women, horrible atrocities, sexual mutilation. Where the hell are you? And after reading this article, it was hard not to understand that anger and that frustration. Okay, so now some good news. This slide is, we're going to talk about harmful traditional practices. And one of them is female genital cutting, also known as female genital mutilation. Move my little picture box there. Okay, better. So in Liberia, traditionally, rape was underreported because women were told that they would shame their families, they would not be believed, and the perpetrators were very seldom brought to a court of law for actual justice. When they were, generally they were not prosecuted, and this happens in other countries as well. But incorporating the leaders of a community, the respected elders, the people who have influence, who are living in that community and understand it, change can happen. So Chief Wilfred Gar is a traditional leader, and he organized a lot of other traditional leaders, and they discussed the issue of sexual violence. And now it's recognized as a human rights issue and not just something that happens to women who aren't where they're supposed to be, or who don't fight hard enough. So there are more resources, and they are actually bringing perpetrators to justice in his community. Another traditional harmful practice, female genital cutting. Ma Yao used to practice FGM. She now farms and also acts as a midwife. She used to practice FGM, believing it was a necessary tradition. So in a lot of countries, it's considered necessary to preserve the woman's chastity and make her a better wife. And women who don't have the practice done are considered unmarriageable. So they frequently do it to very young girls in unsafe, unsanitary conditions, and death can result, infection can result, scarring, obstructed childbirth later on, and many other problems. So once she was educated on the harms of this practice, she stopped doing it, became a farmer and a midwife. And more importantly, her transformation had this ripple effect that's quoted here, inspiring up to 50 women Zoes, traditional leaders, to follow her example and leave FGM behind. That's a success story. There are a lot of harmful traditional practices in the world, based on gender norms. One of those practices is dowry killing, where the family of the groom gets insulted by the low dowry amount that they receive from the bride's family, and so they kill the bride as retaliation. They didn't get what they thought they were promised. Honor killings are another harmful traditional practice. Um, there are quite a few. Honor killings happen if a woman is unfaithful, or if she has premarital sex, or even if she's raped and not believed. And it usually is perpetrated by the woman's father or brothers or husband. They will kill her to save their families from shame. And those practices are changing as well in most places. Um, and I think this is the last one on this issue. We're going to talk about mental health and gender inequality. And with mental health, there are a lot of disparities. It's the least funded, least researched area of medicine. And yet it has such an impact on the quality of our lives and causes such a burden of disease. So when they studied girls and women on a widespread global scale, they found that 60% of adolescent girls feel sad and hopeless most of the time, persistently sad and hopeless. It's taking the biggest toll on girls and women, this author is quoted as saying, whose rights are rolling back around the world. And the United States is sort of in that same boat. And Sia Nowroji, who is a public health official, is quoted as having said, "I don't think it's a coincidence that as girls and women around the world lose control over what happens to our bodies, including where we can even be in our bodies, we're seeing this crisis intensify." That's a pretty powerful insight. Um, in countries where child marriage is common, it's not uncommon for these girl brides to commit suicide, sometimes in horrifying, appalling ways. And we need to get serious as a global community at controlling some of these things. All right, we're going to push forward into big players in women's health. I'm really only talking about two. You probably already know them. The CDC, who created Healthy People 2030. And the idea, healthy people sets goals and then they measure their progress towards goals. So let's find out how we are doing, because if you can't measure it, you can't manage it, because you really don't know whether what you're doing is working. So on the objectives, I'm just going to do an overview. We met 2 goals. We're making progress towards 3. 19 goals are either not making any progress or actually getting worse. And 11, we have no data because we just started doing them. Let's take a look at what some of them are. So yay, we are reducing the rate of death from breast cancer. But we are not increasing the proportion of females who get screened for breast cancer or cervical cancer. And we are not increasing the proportion of females at increased risk to get genetic counseling like BRCA testing or testing for Lynch syndrome and ovarian cancer. Family planning. Okay, so we're getting better at inter-pregnancy spacing. For health, it's really recommended that women wait at least 2 years before giving birth again. And we are reducing pregnancies in adolescents, so that's great. But we're not doing so great when it comes to increasing behaviors towards contraception or increasing access. Listeria is getting worse. That can cause birth defects. Really not making any progress towards osteoporosis, which is crippling for postmenopausal women who have fractures. Hip fractures are associated a lot of times with earlier death. Okay, so we have fewer pregnant women smoking, but the pregnant women who do smoke are not being as successful at quitting as we would like. We're actually getting worse on that. We're getting worse on increasing access to prenatal care. We are getting worse at maternal deaths. We are getting worse at reducing cesarean births among low risk populations. We are getting worse at preterm births, really just getting worse with our care of pregnant women um, in most cases. Um, we are getting worse at syphilis, although we are getting better at reducing pelvic inflammatory disease in female adolescents and young women. Um, Still not getting women the health screenings that they need. Vaccinations, developmental, we don't know enough about it. But yeah, 2 steps forward, 5 steps back. 19 goals, we're either making no progress or we're getting worse. But we did get 2. We met our targets on 2. So that's something. And what about globally? So I do want to play you this very, very short clip of a video. The World Health Organization has their goals. Mhm. Sorry. So 286 years to make us legally equal to men around the world? That's crazy. Um, 300 years to stop marrying off children, to to alleviate poverty to some small extent in in a family. I don't know. 140 years to get us equal representation in leadership positions. I don't know. I think we could do better than that. I'm going to link to this. This is like the 6 priorities that they came up with in 2021. So, addressing gender equality in the COVID-19 response and recovery. Mortality rates were higher among men, but women are bearing the brunt of COVID-19 social and economic consequences. So, they're trying to get that sort of on track. Elevate the position of women in the health and care workforce, and we are 77% of that population. So we should be compensated fairly if they want us to keep doing it. Prevent and respond to violence against women. This is definitely a priority. Um, there's a lot of material on the World Health website about gender based violence. Ensure quality sexual and reproductive health for all. Um, and yeah, that's their 6 priorities. So the World Health Organization is doing a lot to try, but they're not meeting their goals either. The Sustainable Development Goal number 5, um, we're not making progress. It's the same as the CDC scorecard, and I can get that material to you if you want it. I just didn't think to include it here. Okay, yeah, yeah, no, we're done there. Okay, and let's move forward. And these are my reference sheets. Feel free to look up any of them. Each slide you noticed had that little link to the full article. I encourage you to read the ones that interest you. Maybe get some ideas for the projects you're going to be working on through the semester. And that's all I have for you. Good night. Good luck. And we will be talking again.